Welcome to the Don't Count Me Out podcast. This program is dedicated to stroke survivors, loved ones, and caregivers, medical professionals, and anyone interested in learning more about this devastating disease and the warriors that face it every day. Our mission is to share stroke survivors' stories of inspiration and hope, form friendships and community, gain knowledge and insights, and the courage to dream and explore new avenues as we find our way back to living. So, my friends, the Don't Count Me Out podcast begins right now. I love music. We'll get into more about what the neuromusical therapy is all about. Jennifer, I think I'd like to start with you. Tell us a little bit about what this wonderful therapy is all about.
I am a board certified music therapist, but I have training that has gone beyond that. Neurologic music therapy. It's really interesting because especially people that love music, it's one of those things that music is one of those intrinsic things where you have a heartbeat. You have this drum playing inside you and so with neurologic focused treatments, we use rhythm a lot and it has to do with that entrainment of the rhythm and it inspires you to do something or to connect with it. There's research behind it where music actually uniquely forms new connections in the brain. And so that is a really huge deal with stroke survivors where you're trying to recreate things that you might have had before. And music allows you to do this a lot faster, even in conjunction with all the other therapies that might happen. So it's one of those really exciting ways that, I mean, they're coming out with research every day using the new technologies, the MRIs and that kind of thing on how effective it is. And so I think that's a huge thing. If people want to get better faster and they want something that's effective, it's just sort of a little taste of what the neurologic side of music therapy is about.
Jennifer, when you say that it helps with the regrowing of the neural pathways, is it more in playing or just listening to music that does that?
It's more powerful if you are participating. You really have to be participating. Listening can kind of help, but it's when you're actually physically doing something with it, then you're firing, like move this hand to go this way, but in the same time, it's a lot more complex kind of structures that you're recreating in your brain.
Like we did.
Yes. This is my patient. We haven't been with each other for a couple of years because I moved away in COVID, but we ended up doing a number of these kinds of different little tasks.
Can you give us an example? For me, I used to play the piano and I just haven't been able to get my fine motor skills back good enough. Maybe I'm my own worst critic. I used to play pretty well, but I just can't seem to get motivated, number one. And then my fine motor skills just don't seem to be good enough to, make any kind of good sound or play a good piece.
Well, and piano is a really great thing actually for fine motor skills because you're having to really focus on each area of your hand, your fingers. Have you ever worked with a metronome when you're playing the piano?
Oh yeah.
Okay.
Yeah.
Because again, kind of going back to the rhythm, that's one of the fundamental foundations of what we work with is can you play, even if it's something like a 5-note scale, 1, 2, 3, 4, 5, 4, 3, 2, 1. If you can play it in time, a certain amount of times, those are some places that you can start. I mean, it's not super exciting, but what is exciting is say if you're working with a neurologic music therapist or NMT is if you're playing with me. So say I'm there and I may be playing part of a song and then you have to play something with me and you have to initiate, those fine motor skills. So some of it, we always start with an assessment to see where you are because sometimes, especially with stroke survivors, you might be able to move your arm but may not have the fine motor skills, but sometimes you can see a twitch. To say the twitch of today is the note of tomorrow. It's you can see that impulse is there. It's wanting to happen. It's coming from your brain down to your fingers and you want to do that. So it's working with that want to as well as with the rhythm, but also what you're able to do. Because it's definitely an area where we don't want to run before we walk. kind of thing, because some people might want to, be able to play very fluently, but what actually needs to happen is that we start with some smaller skills and then build up. But it's a lot of what we're doing is sort of, it's very repetitious, but we try to make it fun. And there's usually a lot of laughter. Right, Duane?
Yeah, I can see a little bit of you've got some stories, both of you can tell them. The therapy.
Well, it is a lot of fun. Jennifer does a great job. She's very good at what she does and very relaxed with it.
Well, we have that one videotape too of you with Jennifer, and why don't we put that in right now so people can see exactly what we're talking about and hear your fine musical abilities doing.
Okay, can you do it, or do you want me to do
No,
it?
I don't have a clue how to do it.
Okay, here it is. Is it full screen now? Should be.
Yes.
Okay, here it goes.
Introducing the world's greatest singer. Just kidding. It's just me at music therapy. I know you must be saying, so music therapy is just singing? Well, that's what I was thinking too until I found out what it really is. Yes, singing is involved, but it's so much more. What you're watching now is just some of the things we do during music therapy. You see, after I was discharged from the formal rehab therapy, I was struggling on my own to improve. I thought I was doing pretty well, but I knew there was still room for improvement. And then I was introduced to Dr. Jennifer Jester, who is a neurologic music therapist. She told me about what she did and how it could help me, so I decided to give it a try. I was really surprised when she told me how she could help me with my gait or how to walk better. I thought to myself, are you kidding? Music can help me walk better? If you're like me, that's been one of my biggest struggles. I had no idea that music could make a difference in how well I could walk. So how does it help? Well, music has rhythm, and mixing that with the mechanical aspect of movement somehow kind of keeps it all in balance. It kind of sets the pace and keeps things on track. Have you ever had a song stuck in your head and almost couldn't think of anything else? Well, that's a little bit of how it seems to help with speech. For example, if I were to start singing this song, oh, what a beautiful, the next word is morning. It's just natural. And then I continued, I would say, oh, what a beautiful day, right? The next word just kind of falls in place. Well, it's that automatic aspect that seems to help it work. The beat of music is consistent and predictable. Usually the melody and the words to the music is so familiar that it just seems to flow so naturally. And we already know the benefit of repetition. Doing or saying things that is difficult makes it easier when you do them over time. And we already know the benefit of repetition. Doing and saying something that is difficult, it makes it easier over time. That's what I would kind of go for. So as you continue with your recovery process, you may want to consider a professional neurologic therapist who understands and knows how to use music to take your recovery to the next level.
That's awesome, Duane.
It should have stopped, right? Stop sharing.
Yeah.
Okay.
Yeah.
Sometimes when people, like even as I was watching, I was like, okay, we were working on this and this, like you were wanting to have your arm being able to extend.
Right.
Was some of the, like the drumming was actually working on like extending it in time and also working with the reach and fully. And then you saw the piano, which was to kind of, work on the independent fine motor skills. And we ended up using, I think we used the little piano, but then we went to a bigger piano that's more man hand sized. those small pianos were small. The pool noodles, that was a fun one where, again, working on that arm for some extension and also getting to fire, when you wanted it to. So we used some really great Irish music that was kind of like, I don't know, like what you would hear on Riverdance or something that it inspires you to want to hit the pool noodle,
Yeah.
where you're going. And those pool noodles are great. Like it's basically, I chop them down into 3 sections. So if you want to make a pool noodle at home, I use these a lot because they're easier to grip. And so like sometimes drumsticks are just not very, like they're just hard to hold. It's kind of like a pencil. Like sometimes people just aren't ready to hold those yet.
Do you get the pool noodle that has the hole in the center?
It's got the hole. You can grip onto these really well. There's also one thing that wasn't pictured, but that I like to use a lot with the pool noodles is to actually try to independently move your fingers so that you're kind of like, if I had the pool noodle, it's like an itsy bitsy spider climbing up the pool noodle, but you're working on grip, but also letting go.
And letting go is very hard at first.
Yeah. You kind of have to let go before you can climb up. So this is another one that's really great. Like Bob, when we were talking earlier about the fine motor, like sometimes this is where people need to start.
I remember when I first got movement in my right hand and my fingers, I was able to grip and I showed it to my occupational therapist at the time, and she was very excited. But then she says, "Now, can you release the grip?" And I thought, "Oh, I hope so." And I was able to do it. I was really interested in the scales that you were playing, Duane. I was wondering how long back was that video shot, and do you keep working at it? And are you seeing improvement?
I would say that was at least 2 years ago, wasn't it, Jennifer? Something like that, maybe a little bit more.
Early 2020, maybe, or
Yeah, it was way before COVID. Yeah.
yeah.
Yeah, I keep at it. I'm always doing stuff. I'm very active. I don't play the piano anymore. Now I can use all my fingers, but it's the real fine skill. In other words, doing the scales is still hard, but it's a whole lot better than it used to be. I would imagine. See, I was not a piano player, so it's not something that I've got that big drive to go back and do again. Now, somebody who was, they probably would do it a lot more than I do. I'm more getting hammers and nails and pliers and things like that than playing on a piano. That has helped me because now I can use my hand. The other day I went out in our vehicle and I had to change the front brakes. Well, when I first did it, when the first stroke first happened, I couldn't even use my left hand at all. So now I can actually get the parts and hold them up there. My right hand, of course, does everything that really needs strength for, but my left hand, I can now engage it and make it a part of the activity. So it is still improving.
That's a good point, Duane, and people need to kind of remind themselves of it. No matter what you're trying to learn, keep doing it. Keep the repetition going, because 5 years later, you can still add something else to your repertoire that you weren't able to use early on. And it's always exciting when it comes back because it seems to happen when you least expect it.
Well, and one area that we didn't show very much of in that particular video is actually working with speech. And Duane is a very accomplished YouTuber and has already had pretty advanced speech, but there were just a couple little things that we would work on. I think some of the S's. Yeah. You remember some of the Sally sells seashells at the seashore.
Yeah.
And there's
a lot of those.
Yeah. And it's sort of like using tongue twisters, but I don't have instruments with me right now at my mother's house. But if I had a piano or an auto harp, we would start in a let's see, let me find one. Busy bees buzz. Busy bees buzz. And you start slow. And it's sort of using singing, like we're going to go up the scale. Busy bees buzz. And so this one's very much like the focus is external frontal. So if you have problems with like z, b, those two elements in your speech, this would be a part where the progression is to, depending on where the person is at, can they sing it with me? Busy bees buzz. And what is the quality of that? And then you almost have to over enunciate it in some parts where you think, well, I can say B, but but it might be maybe not the quality that you want. So you really are busy bees buzz. It looks really strange, but you're over enunciating because you're basically lifting little weights in your lips. Same with S's, T's, F's. F is one of those frontal exterior areas. So I have little, thanks to Dwyer Conklin, he's an amazing neurologic music therapist. I borrowed some of these from him, but there's similar to speech therapy. You're working little specific sections of your speech, but with the music and with rhythm, it all kind of helps you develop that through the years. So as I was listening to Duane talk, I was like, Duane, you're sounding great.
Coming along. Everybody tells me I sound fine, but it's just a little struggle.
You hear it inside. What you say sounds different to you than it does to others.
Yeah, I was going to say, I never knew Duane.
Yeah.
We've been on together a few different times.
One of the things that I learned when I was working in radio, and I don't know if it's used with what you're doing or not, but if you talk with a smile, even though people can't see you on radio, if you talk with a smile, it lifts the words and makes them sound happier. Otherwise, sometimes, especially if you're doing a commercial or something, you really want to get your point across, it can sound too forceful. But if you do it with a smile, it draws people in. Do you find that with what you do too?
Oh, what'd you say?
Do you talk with a smile on your your shows?
It's one of those things. Everybody tells me they can understand me just fine. However, when I think back when I talk to my speech therapist, there's two parts to speech. One is getting the words out, but then the other part is the feedback coming back to the brain. And both of those were messed up. Well, I'm able to speak pretty well now, but I don't hear it well. I sound very distorted. And I think some of that is because, like you're talking about smiling, the left side of my face doesn't work. It's usually numb most of the time. So it's hard for me to smile evenly. Now I can smile, but one side's going to go up and the other one just stays there. Well, the same thing happens when I talk. Certain words, it's hard for me to actually physically form the lips to make them sound right, but it's getting better. It just takes time.
Duane's worked really hard on it. That's the thing with all of this, that it's not a do it in a day and you're gone. Like it takes repetitions and time and patience.
It takes a lifetime commitment, really.
It is.
Get past it.
Yeah. And even being able to work with somebody, because sometimes the self-motivation, that's a really helpful thing, either with an NMT like me or a spouse or a friend. I've seen if you kind of have a buddy to do some of these things with, so that you're not alone, and I think programs like this are so valuable because it helps people realize that they're not alone. There are a lot of people that can be part of your support group.
Yeah.
Where would people, if they're interested in doing something like this, where would they go to find someone like you, or to find a group in their community that does this?
Well, for a neurologic music therapist and specifically, there's actually a website where we all got our training, and they actually have a listing of all the practitioners. So if you go to nmtacademy.co/find an NMT, there's actually a listing, and you can search by state and zip code and city. Locally, you can search your own local music therapy or neurologic music therapy, and then your city. It's N as in Nancy, M as in mother, T as in Tom. So nmtacademy.co/find an NMT. So like I've actually had a couple patients find me through that they were looking for something really specific.
Let me share the screen here. Is this what you're talking about? Is it all right if I share this?
That would
Sure.
be wonderful.
Is that it?
Excellent.
Let's see. Yeah, if you go to where it says find an NMT in there.
Right here?
Yeah, that's the page. This is our main home. Square to the left, it says directory.
Directory.
All right here? Yeah.
Yeah.
And then go down there.
And scroll down.
See if we can find you on there, huh?
Well, if you go to the top of that little section where it says search directory,
Yeah.
You can type in whatever city or
Jennifer Jester, right there, right?
me, yeah.
In Lancaster, Pennsylvania. And
Mhm.
this gives your contact information, your email, even a phone number. It even gives a Facebook link.
My recommendation, especially since this is probably viewed all over the world, is to search your area and see what's available, but also contacting any like just music therapy in your city or state.
So Bob, what city are you in?
Belleville, Michigan.
So if we search for Bob, so there's different cities in there, Grand Rapids, Taylor. So these are different people in your area. It's got quite a few on there.
Good.
Thank you for putting that up. I
Yeah,
think a
Duane.
lot of times people, especially stroke survivors, are visual when they're trying to learn something. One thing that I was thinking about, my mother-in-law had a stroke, and she was aphasia. She still knew how to swear, and she had never been one to swear before the stroke, but it seemed like she had one favorite word that she used for everything. Anyway, we used to get together with her quite a bit. We would take her out for rides. And my husband and I, anything we said to her, we sung it to her, which got her to giggling. And we just had some really good times. But we got her to a point where she would start to sing words back to us. And we were the only ones in the family that were able to communicate with her that way because she was shy and didn't want to do that. But I know for her, music was always a big part of her life. And even after the stroke, if you had the radio going, especially on music from the 40s and 50s, she would sing every word to every song. And so is that something that's helpful to encourage people to get into something like this? Or for you, Jennifer, when you're teaching others?
Absolutely. And you kind of mentioned a few different things of just outright singing, but you also mentioned something that is a great place to start, especially with people with aphasia, is like if you have a familiar overlearned song, something that we just know because we've had it our whole lives, like "You Are My Sunshine." You know, sometimes that impetus actually help people start moving through the blocks. You are my sunshine, my only.
When you should know that word.
Yeah. I mean, it could be anything. You mentioned 40s and 50s, and that's a big deal too. Is picking music that person likes. People want to pick something they know and like, but it's like, no, this is about the person that you want them to be inspired to to contribute. If there's something meaningful, absolutely. And you can't go wrong with singing at all because it's working all of these things, you know, like you're using the rhythm of the song to sing with it. You're exercising all of your muscles around your mouth and tongue.
Back when we did that, we used the song Danny Boy. Do you remember that? We used the song Danny Boy, and that was helpful.
Yeah, absolutely. And within neurologic music therapy, we actually have different categories of assessment that we would use in therapies. And so like one of them, melodic and intonation therapy, is used a lot with aphasia. Rhythmic speech cueing is that one where we actually might tap on a hand. You are my
Sunshine.
you are my sunshine, so that you're trying to get that rhythmic cueing happen. Also musical speech stimulation, vocal intonation therapy, that's the one where using the busy bees buzz, where it's a tongue twister, but I'm not just saying busy bees buzz, you know, it's using the music to kind of shape it. And there are some like stroke survivors like Gabrielle Gifford, who was a senator in Arizona that was shot in the head. She was using a lot of these techniques to rebuild her speech. And so sometimes you might latch on to the music of a phrase like, I need to eat now. And they remember, I need to eat now. The music of it can help people rebuild an entire vocabulary. It's amazing, like the spectrum of singing what you're able to do. It's really, again, based around what individual needs.
How did you get into this as a profession? What was your inspiration?
I've always been interested in drumming in particular, but the therapeutic effects of music. I got back into this later in life. I don't know, early 40s, I'd say. I went back to school to have this certification because it's something that when you practice music therapy at all, you need to be able to have the credentials behind it. Otherwise, you don't really know the detail of it. And I just really fell in love with music therapy, and there are so many aspects of it. You can kind of specialize in different lanes, like if you love working with early childhood areas or people with special needs, or for many years I worked in hospice. Then there's the element of rehabilitation, which I really loved. I love watching people get better, as well. And so it was kind of a nice contrast to hospice, which is more just about comfort. This was a really positive, happy thing that I've just been drawn to. And yeah, there's so many amazing people that are sometimes stuck in themselves. And so when you see those glimmers of like that person is coming back, they're able to speak again or to talk again or move like they want, like that's just amazing to me.
I'll tell a quick story. When I was recovering from my stroke, as my fingers began to move, I wanted to see if I could do the thumb crossover, basically to do the scales on the piano. So I practiced that. And my occupational therapist came in one day and he says, "What are you doing?" And I said, "Well, I used to play the piano and I want to see if I can do the scales." And really, so the next day when he came in, he says, "Hop in the wheelchair," and he takes me down to the dining room area. There was a piano there in the dining room area, and he pulled the piano bench out of the way and he pushed my wheelchair up in it. He says, "There you go. And a practice, you might as well practice on the real thing." So and that helped. But then I started realizing, oh boy, I got a long way to go. But it was to him, it was important, that he give me that chance or give me that therapy. And it was to me too. And we did that a few different times while I was there. So I can attest to how much it really helps.
I think that's very difficult, is the discouragement when you do sit down to do something that you still remember so vividly that you could do without even thinking about it, and realize that you're back to square one. How do you help people keep motivated and realize that they are making progress?
I think just being there with them. This is one of those therapies that if I had nothing else to do and I could just hang out with people and be there all day, every day, like, let's make some music until I wear you out. Because that's the thing that happens. Like, you're thinking so hard to make these happen. Like, it's exhausting, right, Duane?
That's one thing that a lot of people don't really quite grasp at first, is people recovering from a stroke. Fatigue is such a strong part of that. We have to overcome that. And when you start something brand new, it really fatigues you out and you just get tired. I know when we would get done with that, I'd go home and I'd have to take a nap because I was just too physically kind of drained. I'm doing better now, but at the time it was kind of rough.
It should always be fun and positive, and activities that we do, it's also measurable. Neurologic music therapy is based on interventions that are actually like clinically measurable, so that you can see progress, and it's a lot. The documentation is there. We actually do a lot of documentation because we need to know, are we doing the right thing? Are we going too fast? Or is it not fast enough? Or another huge way, like Duane right off the bat wanted to videotape through his sessions. And so like you can see improvement through his sessions. And one of the things we didn't really touch on yet was, you probably saw the ballet bar, and we were working on some aspects of his gait. And so you can see like we are actually doing small movements that are broken down. So like it might just be the lifting up of your toe on the ball of your feet, or it might be that first step where initiating a walking pattern. There's like all these bigger movements, but they're broken down into small movements. And then using the auto harp specifically, that's one of those things that people ask, why are you using the auto harp? We haven't seen that in 100 years or something. And it's like, well, it has that ring, 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 kind of aspect to it, where if I played guitar, it's like strum, it doesn't have that time, whereas this lets you get into the quality of that particular movement. You can almost feel like you're, like if you're on your foot, your muscles, like you're going through every portion of it as you're working through that movement.
To be mobile too, because I remember several times you would walk behind me, as we'd be walking down the hallway and things like that.
Mm-hmm.
Yeah, it keeps you mobile.
Yeah, we did some hallway walking and follow them around with the auto harp down the hallway. You got to have that inspiration, and we're using the rhythm. So
Did you ever hear one of the other patients in one of the rooms going, "I'm coming, Marty"?
I think most of the time we did it was just Jennifer and I. You do groups sometimes, at least you said you did, but we just did on one-on-one.
Well, and COVID's really put a damper on it, but
yeah,
just started going to people's homes. One thing that I find, especially with people that are early in the process of rehabilitation, is that it's really hard to go anywhere, especially if you're dealing with a wheelchair. In Pennsylvania, things are just old enough that sometimes it's not as accessible as you would like, especially if I brought them to my home or something.
So you do a lot of mobile where you go to them?
Yeah. And I know that there are some therapists that will do just like this with Zoom, especially if you're in high risk for COVID category. And so there's a lot of different ways that can happen.
I know at one time there were choirs of people that would get together that may have felt more comfortable being in a group of people rather than working one-on-one.
Absolutely.
Do you do that through Zoom as well now?
I don't know. I don't personally do Zoom, and the last 2 years have definitely changed. I think there's room to do Zoom, especially with some folks. It's one of the few ways that there's contact with the outside world. I'm very much like an old school. I love in person. The way things are going right now, that's not a good thing for some people to go back into a group. I mean, my intention was to do that. I'm also noticing that there are a number of people, even younger people, that are having COVID-related strokes. And I see that there is possibly a need. I think there's a giant need for more of this type of therapy. It's sort of like a whole new subset of people that are having strokes. And I think that's something that really needs to be looked at. One of the things that's difficult with the group aspect is that every person is so different in their needs. Some people might have a right brain related stroke injury, and somebody might have left and they need this speech versus that, or even just the amount of physical activity that somebody can do. Like, that's where groups are hard because it's really that one-on-one that makes the difference.
What do you see for the future for the music therapy, Jennifer? Do you have a finger on the pulse?
Well, I think it is an extremely effective therapy. There are more practitioners that actually have the neurologic music therapy designation. It's strength and power in numbers to be able to help more people, especially with the research behind it and the advances with all the neurologic related study that's happened. Like, it is right now is very, very exciting with the types of things that are coming out. The end game is to get people back to their lives as fast as you can. The biggest thing to remember too is that if you do it with all of the therapies that you might be involved with, it actually has been shown in some of the research that the music therapy combined with physical therapy, and sometimes music therapists will work with physical therapists with the musical aspect as they're doing the therapy. Like, it's really amazing what they're seeing, because it is very exciting, especially as somebody who works with stroke survivors. Like, I want to use something that works. I don't want to waste people's time. It's important to me that value is there.
There's someone that has a background such as yours, maybe not the certification, but a background and a love for music. Where would they go to find out more information to maybe join the field that you're in?
If you search music therapy university or degree programs, where those programs are available to become a music therapist, if you have a background in music, you'll need a music therapy degree in addition to a 1,000-hour clinical internship, and then pass the board certification test, which is no easy feat. Then you can call yourself an official music therapist. There are lots of people out there doing music, and I certainly don't want to take away from that. Just know that the level of training is very different than people that might just play guitar in a hospital, and making sure that you're not going with somebody that has the designation is important. It's an amazing time right now, and I feel like there's so much need, and it's an area that touches on so many neurological conditions. We work with people with autism, cerebral palsy, Down syndrome, Parkinson's, traumatic brain injuries, developmental delays. It encompasses that whole area, and there's a lot of need.
That's an area, we all have one to some degree or another. It's an area that all of us are kind of mystified about. How does it really work? When something happens to you and you lose part of what you do, inside you have a little bit of a different understanding of what the brain can and cannot do. And the people around you are beginning to learn that something is different, something that they really don't know a lot about. I know for myself, just watching children and how they do some things sometimes that we think, stop climbing on that display in Walmart. I don't want it falling over. And if we looked at them again and said, hey, they're really building up their quad muscles, or they're working on this, and we ought to be celebrating. You go, you knock those cans over, you're doing a great job. It gives us a different perspective on life, actually.
If you think about like what happens when somebody has a stroke, it depends on the person's stroke, but basically that area isn't working anymore. And so if you think of like a pencil drawing, you basically have to make a little pencil drawing, like a line around that area. One swipe of a pencil is one little thread. And music therapy and all these neurologic therapies in particular is like drawing over that line that's going around that area over and over and over again, and making it thicker and stronger, so that your brain is actually able to draw a lot of these pencil drawings around a damaged area. And that's really what's going on. It's making the quality pencil lines stronger and thicker so that it's back to normal again. That's really what this entire thing is about, is building back your neural pathway.
I know that was one of the things I was most excited about, was the neuroplasticity and the work that people have done in regard to that. And it just seems to open up all these other avenues. There's never a good time to have a stroke, but I think for us, Duane, Bob, myself, to have a stroke now when all of these things are available to us is really miraculous, even with the deficits that we still have, to come back and to live a good and productive and happy life.
Like you are providing survivors like us plenty of hope, Jennifer, really.
Doing my best.
Yeah.
I thank you so much, Duane. It's so good to see you. We talk every once in a while as much as we can, and you have been a lifesaver to me more than once. And Bob he's always there for me. Him and his wife Sharon, I don't know what I would do without them. And Jennifer, I'm so happy to welcome you to our family and have you here. You are always welcome to come back on the show. Anytime you hear something new or want to share something that you've discovered, you're always welcome.
Thank you so much for having me.
Are there any last minute things that any of you would like to share before we say goodbye?
No, it's good to see you again, Jennifer.
Great to see you, Duane.
Take care out there in Pennsylvania.
Thank you.
So right now we got Jo Ann in Florida, you're in Pennsylvania, Bob's in Michigan, and I'm in Missouri. We cover the ground, don't we?
Yeah,
We got it covered pretty good.
I love that about Zoom. I mean, we can be so far away and yet all together. Thank you, everybody, and we'll see you next week.
Don't count us out.